All right. Hi, Carla, and hi, Lauren. Thanks so much for taking the time to talk about our 2023 State of Early Childhood Report. Before we dive in, I want to first provide some framing for anyone listening to this Q&A. As an organization, Connecticut Voices for Children has prioritized early childhood education since our founding in 1995, and we have published a State of Early Childhood Report since 2003. While we've recently broadened our attention to fair employment writ large with a focus on the early care sector, we maintain our work here because we know the import and impact of ECE for children, particularly children of color, and the economy, particularly the participation of women and women of color in the workforce. Unfortunately, today, there's a national childcare crisis in the United States. Parents can't afford quality care and often lack proximal access to it. Educator wages are undignified, and providers can't hire fast enough, and the federal dollars and state contributions are woefully insufficient. The understanding that the early care market is broken is so widespread that U.S. Treasury Secretary Janet Yellen is saying as such. Now, in truth, the current challenges the early care and education sector face existed before the pandemic. However, what's changed is that we're seeing a greater willingness to do something about it. In Connecticut, Governor Ned Lamont and Commissioner Beth Bayh have renewed our state's efforts to fix our early care and education system. They understand, like we do, that early care is essential infrastructure, and the Blue Ribbon Panel's report, released late last year, speak to the transformational change needed. This week, we released our 2023 State of Early Child Report in response. While we continue the arc from our last three State of Early Childhood reports we published, this year's report is a little different from the past because we set the policy recommendations as a side-by-side response to the Blue Ribbon Panel's recommendations. I've asked the report authors, Dr. Carla Abdo-Katsipis and Dr. Lauren Ruth, to join me in a Q&A to help explain what's in the report and provide some context for why we're publishing it. So without further ado, let's get started. The first question is for either of you. In 5 sentences or less, what is the 2023 State of Early Childhood Report about?
So we publish the State of Early Childhood annually, and every year we review trends and gaps in Connecticut's early care and education system and the impact of ECE policies and funding on children, parents, providers, and Connecticut's economy more broadly. In addition to reviewing these annual data regarding childcare availability and childcare enrollment, this year's report had 3 other facets. First, we updated our previous family childcare home and childcare center financial models to show the impact of increased inflation, the rising minimum wage, and increased care for kids reimbursement rates on the sustainability of childcare providers. Second, we shone a spotlight on the rising proportion of very young children with special needs in Connecticut, Connecticut's programs and services to support families of children with special needs, and the systemic challenges the state faces in providing for growing needs. And third, we contextualize our findings and our policy recommendations in light of the very important work done by the Governor's Blue Ribbon Panel on childcare.
Thanks, Lauren. I think that concise explanation is a really great teaser to get folks wanting to learn more. Carla and Lauren, maybe you both could answer this question as a reminder to the folks who are listening to this Q&A. What are the benefits of high quality early care and education for children?
Thank you, Emily. There are multiple benefits of high-quality early care and education for children. High-quality infant and toddler care has been shown to boost memory and language skills, resulting in better academic performance and social relationships in kindergarten. Gains from preschool include school readiness skills, social, emotional, and behavioral development, improved motor skills, problem solving, language skills, pre-math skills, and self-regulation skills. Children who have experienced high-quality preschool tend to be more confident and have improved focus. For children ages birth to 5, high-quality childcare reduces disparities and closes achievement gaps in learning, particularly among children from low-income families, immigrant families, children of color, children who are homeless, and children with special needs. These findings are particularly significant because these children have the least access to quality care.
And to build off of what Carla just said, if we think about attachment, which is a pretty common buzzword these days, when we talk about our youngest children, though, Providing environments that are conducive to forming secure attachments with caregivers is one of the most important things that parents, educators, and communities can do. So children who form secure attachment bonds tend to experience better relationships, better physical and mental health, and higher educational and career success throughout their lifetimes. High quality, predictable ECE helps lower parental stress and provide a source of support and educational opportunities for parents, all of which allow parents to be more emotionally available to their children, which is what's most critical for supporting the development of secure attachments. ECE workers also create attachments with the children in their care. So high quality ECE is actually a huge part of creating this warm and responsive environment where whole families thrive.
Thank you both. I think that's so important. Oftentimes when we talk about early care and education, we're so focused on affordability for parents and fair wages and benefits for providers, but we often forget that we're doing this for kids, right? Ultimately, we need to center the child in this. And so I think the information that you just provide is so important. Having read the report myself, I know that there was a study released in 2018 that stated the federal government lost $400 in income tax revenue and $230 in sales tax revenue that year for every working parent. The replication of this study for 2023 found that the COVID-19 pandemic more than doubled these effects, resulting in an estimated national loss of $78 billion in parental income, $23 billion in business operational expenses, and $21 billion in taxes, culminating in a net national loss of $122 billion, which may quite frankly be undercutting the total loss given that the study only examined the impact of insufficient infant and toddler care and didn't extend to preschool. At Voices, we believe that early care and education is an investment and that should be funded as essential infrastructure. However, when we talk about investments, someone somewhere undoubtedly asks about ROIs or return on investments, but we want to meet folks where they are. And so my question to the two of you is, what's the fiscal return on investment when we appropriately resource early care and education?
Yeah, high quality ECE has been shown to be one of the wisest investments governments can make in terms of both short term and long term returns on investment. So, short term returns on investment are those that are realized within a few years, and long term returns on investments are realized once children grow into adults, which is within a few decades. Access to affordable and predictable care allows more parents to engage in the workforce, which we talked about, and it allows them to be more productive at work and to have greater advancement in their careers. This contributes to businesses being more productive and to an increased collection of taxes, as you mentioned. Additionally, the ECE sector is an industry in its own right that provides services, purchases goods and services, and employs workers who engage in economic activity across the state. So in terms of short-term ROI, state-level estimates suggest that each dollar the government provides to support ECE creates $3.80 in greater economic output, which is the combination of ECE industry-level economic output and increased parental employment and spending. And as I mentioned earlier, high-quality ECE also has very high long-term returns on investment through increased school and career achievement for children, reduced costs of remedial education, reduced healthcare costs, and reduced engagement with the criminal legal system. The economist James Heckman, who's a Nobel Prize winner for this work, estimates that high-quality ECE yields an annual 13% return on investment per child per year. So in dollars, that equates to each dollar we invest in programs, creating a minimum of $4 and up to $16 in economic returns. So to just very succinctly summarize that, high quality ECE helps children grow into adults who are empowered to produce more income and who utilize fewer government economic resources.
Thank you for that, Lauren. So we know that nationally, the early care and education sector is in crisis. In Connecticut, the 2023 Annie A. Casey Kids Count data book reported that center-based care costs families approximately $18,156 per year, and family childcare home settings cost $11,955 per year. In fact, Connecticut had the third most expensive childcare for infants and toddlers in the nation, just behind Washington, D.C. and Massachusetts. And even while the burden on parents is too heavy for many families to manage, we know that ECE providers in Connecticut struggle to operate their businesses, often earning below minimum wage for the amount of hours they work. What's the current state of the sector in Connecticut in more detail? Opening this up to both Carla and Lauren here.
Connecticut's ECE industry is no exception to the national trend that you were discussing earlier. It is shrinking and unstable and experiencing a significant drop in providers, particularly childcare home providers. There's also a reduction in public childcare slots. At this point, 39% of 3 and 4-year-olds do not go to preschool in Connecticut.
Build off of that, the current economic model that governs the ECE sector relies heavily on parents to pay for childcare, as you mentioned, Emily. This is a really broken model given the necessarily high cost of providing such an important service. Even parents who receive childcare vouchers through Care for Kids are asked to provide a family copay of up to 10% of their income, which, given that Care for Kids goes to some of the lowest income families in our states, is a really significant cost burden for them. To ensure the safety of children, though, childcare providers are only licensed to provide care for a limited number of children per adult, which limits the ability to bring in revenue. And providers are further limited in what they can charge for care based on what parents they serve can feasibly pay and based on what other providers in their areas are charging, called market rate. To demonstrate what this looks like in terms of revenue and childcare program sustainability, our report includes financial models of a baseline quality family childcare home and a baseline quality childcare center. We find that if a family childcare home only collects Care for Kids vouchers and doesn't charge families a copay, the provider will earn $8.14 an hour, which is less than minimum wage and less than what they would have to pay for an assistant. As larger businesses, childcare centers have less flexibility to tighten their belts and make personal sacrifices when families are struggling. So our model found that if a small childcare center only collects Care for Kids vouchers and doesn't charge families a copay, the childcare center will be almost $110,000 in the red at the end of the year. So this shows that under the current model, even when receiving state and federally funded vouchers, providers are pretty much forced to collect significant funding from families to sustain even minimal business models. This strain on providers contributes to a long documented trend of dwindling numbers of providers. Between 2022 and 2023, 91 family childcare homes, or 5% of them, closed. This continues a 2-decade downward trend that has almost halved the numbers of family childcare homes since 2002. Childcare centers this year experienced a small increase of 152 centers, but they haven't fully rebounded to their pre-pandemic levels. As we discussed in our 2021 State of Early Childhood report, the COVID-19 pandemic really hit childcare centers hard because of larger facilities. Many childcare centers had to permanently close their doors amidst the demands of physical distancing guidelines. So as you can imagine, the reduced numbers of providers has contributed to a reduced number of state-funded childcare slots. We found that state-funded infant and toddler slots decreased by 3,490 seats, or 17% between 2022 and 2023. And during the same time, state-funded preschool slots decreased by 2,085 seats, or 4%. State policymakers have really tried to combat this trend. They increased reimbursement rates for state-funded care, and they expanded eligibility guidelines for state-funded programs. And we're encouraged by what we're seeing in these data. Our data shows that efforts to expand eligibility have largely been successful, and many programs reported increased enrollment between 2022 and 2023. So Care for Kids data showed an increase of 1,214 more enrolled infants and toddlers and 407 more enrolled preschoolers. School readiness and Head Start programs also showed significantly increased enrollment. And while the increased reimbursement rates were certainly helpful to stabilize many providers, given the unprecedented inflation rates and rising minimum wage that we saw this year, the increases in reimbursements have helped providers keep up with these changes, but they haven't actually allowed providers to pay their staff and themselves a dignified living wage or move towards a more sustainable economic model.
So the fiscal strains on providers and declining numbers of state-funded ECE slots has contributed to an outlook that's even worse for children with special needs, which is an already underserved population and one that is growing substantially. Both the number of children and the proportion of children eligible for services through Birth to Three, which is a program serving infants and toddlers at risk for developmental delays or already have disabilities, has increased from 2015 to 2021. Additionally, the number and percentage of preschoolers with special needs in Connecticut are rising, and this is displayed by a tenfold increase in the number of pre-K3 students with individualized education plans, which are plans specifically targeted to a child who needs special education, between 2012 and 2022, and a similar increase in pre-K4 students during this time. The number of providers who have the appropriate skill set to provide high-quality care is limited, and children with special needs are 30% more likely to be expelled from preschool than their peers. This suggests that as policymakers debate methods to educate, attract, and retain an ECE workforce that can provide high-quality care, they must keep in mind that the growing need for specialized care, where educators can detect and support children with special needs, is significant.
So what I'm hearing from both of you is that we can just do better all around. How then can the state move closer to high quality early care and education that is universally affordable and accessible to all our state's children and families, while providing dignified wages and benefits to early care and education professionals? What are the recommendations proposed in the report?
Sure. As you mentioned earlier, our report mirrors our recommendations to those provided by the Blue Ribbon panel's 4 goals of their policy recommendations. These goals are to support the retention and recruitment of a professional, high-quality ECE workforce, to increase equitable and affordable access to high-quality programs, to develop an agile and responsive ECE system, and to build a sustainable funding system for ECE. So we are in strong agreement with all 4 of those goals, and our recommendations expound on some more ways to help meet those goals. So some of our top line recommendations to improve workforce and quality include weighting reimbursement rates for state-funded programs, to encourage providers to offer staff higher compensation and benefits, and to increase the accessibility of their programs to underserved populations. Raising the reimbursement rates for state-funded programs to 90% of the market rate, and ensuring parity between family child care homes and child care centers in the rates provided to providers. Providing comprehensive benefits packages that are inclusive of not only affordable healthcare and retirement benefits, but also paid sick days and predictive scheduling of at least 2 weeks in advance for when employees are scheduled to work, and ensuring that the ECE workforce earns a dignified wage, as you mentioned. At the very least, the state needs to implement an ECE pay schedule that compensates ECE educators at similar levels as K-12 educators with similar years of experience in education. However, both the ECE and K-12 systems are losing staff due to long hours, stressful conditions, and unsustainable pay. We know that education is the bedrock of democracy, and offering educators a dignified living wage to support the critical work they do is one of the most important investments that communities can make. Some of our top-line recommendations to improve equitable and affordable access to care include creating a Connecticut child tax credit to help offset the high costs of raising children and to make Connecticut's overall regressive tax system fairer, expanding Care for Kids eligibility to the fully allowable extent under federal regulations, and creating a sister program that extends vouchers to families who are not eligible under federal regulations, including but not limited to families who do not have legal documentation and families earning more than 85% of the state median income. The Blue Ribbon panel recommended extending Care for Kids eligibility to families earning up to 100% of the state median income, and we wholeheartedly support this, but would advocate to go even further, similar to Vermont's recent eligibility changes for their child care financial assistance program that raised eligibility to almost 170% of their state median income. Third, we recommend pairing innovations that are aimed at reducing the cost of childcare for state and families by partnering with businesses with innovations that aim to attract and retain a larger ECE workforce. And fourth, we recommend creating a plan that assesses and addresses the immediate and long-term special needs of very young children in Connecticut, and that leverages our currently existing home visiting programs, ECE programs that are designed to serve underserved populations, public preschool classrooms that offer special education services, and partnerships with other state agencies and community organizations. Moving on to some of our top-line recommendations to improve the flexibility of Connecticut's ECE system, we recommend streamlining and standardizing ECE funding sources, creating affordable housing that prioritizes renting to the ECE workforce, and enacting land use and zoning policies that allow for more affordable housing across the state overall, as well as expanding zoning policies so that potential childcare businesses are able to operate. And third, ensuring that there is meaningful parent representation that includes parents from underserved populations at all ECE decision-making tables. And finally, our top-line recommendations to improve Connecticut's ECE funding system include assessing the actual cost of high-quality ECE and ensuring that Connecticut's systemic changes include reimbursing providers for their actual costs, rather than continuing to rely on the flawed market rate system, and directing dedicated progressive revenue streams to resource the newly developed Early Childhood Education Fund, and leveraging this fund to build a high-quality, universally accessible, and affordable Connecticut ECE system. So our paper discusses several specific progressive revenue streams, and these include increasing Connecticut's estate and gift tax, increasing the top income tax rate on investment income, increasing the top income tax rate on Connecticut adjusted gross income, and establishing a new top tax rate for filers who earn more than $1 million in income annually, reducing or eliminating Connecticut's tax gap, adjusting Connecticut's fiscal controls, increasing corporate taxes in a way that isn't passed down to tax workers and consumers, and utilizing bonding dollars to create new classrooms and to innovate in workforce attraction and retention measures.
Terrific. We're coming to the home stretch now. In 3 sentences or less, why should Connecticut residents and lawmakers care about early care and education?
Thank you for this question. Early care and education significantly empowers children, setting them up for success as adults, providing full employment for parents in the workforce, all of which benefits our state economy. It's also an industry in its own right, which also generates wealth within the state.
And I love this question because it just summarizes everything in a nutshell. High-quality ECE is one of the best supported and most robust mechanisms that we have to close equity gaps. And this results in a fairer Connecticut that offers a higher quality of life to all of its residents. It's also the wisest short-term and long-term investment Connecticut can make in supporting and expanding its current workforce, which leads to immediate economic growth, and in improving the health, well-being, safety, achievement, and economic stability of its future generations. When Connecticut parents have what they need to build thriving families, children thrive, the workforce thrives, and Connecticut communities all thrive.
Thank you both so much for your good work on this report. And if you're tuning in to our Q&A, we are grateful for you too. Connecticut Voices for Children is a research and advocacy organization. At Voices, we believe that every funding and every policy decision should lead us to the future we want, which is a just society where all Connecticut children thrive. Our issue areas center research-backed policies that eradicate poverty and advance family economic security. If this better world sounds good to you, we invite you to join the movement by signing up for our email list or making a donation today. Links to do both can be found on our website at ctvoices.org.